Hi, my name is Chelsea, and today in my sport injury webinar, I'm going to be talking about a dislocated patella. A patella dislocation is a dislocation of the kneecap, also known by its scientific name, the patella, from its groove at the knee joint. When the patella dislocates, it is forced outside of the trochlear groove, which is a vertical groove between the bottom end of the femur and the upper end of the tibia, and can no longer move up and down. This locks the knee and pulls the ligaments out of place, often tearing them. Most frequently, the kneecap pops out laterally to the side of the groove. The primary bones of this injury that are involved are the patella, which is the kneecap, the femur, which is your thigh bone, and your tibia, which is your shin bone. However, none of these bones are damaged or fractured, as this injury more so involves damage to muscles and ligaments. The quadricep muscles are the muscles that are the most affected. These include the vastus lateralis, vastus medialis obliquus, and rectus femoris. These muscles mainly aid in the stability of the knee joint and keeping the patella in place. These muscles can be strained during dislocation. In the case of patellar dislocation, the ligaments on the inside of the knee are the most commonly injured, as the kneecap slides laterally. The medial patellofemoral ligament is often the one damaged during dislocation of the patella. Lastly, the quadriceps tendon, which connects the quadriceps to the kneecap, and the patellar tendon, which connects the kneecap to the shin bone, can be strained during dislocation. These tendons are normally supporting the knee in straightening and stability. There are three main causes of the injury. The first one is direct trauma, which is a strong impact to the knee, such as a fall or collision in sports, which can knock the kneecap out of place. The second and most common cause is sudden twisting or pivoting movements. This normally happens in sports, so quick, sharp changes in direction in sports like basketball, soccer, or gymnastics can cause the patella to dislocate. So the last cause is anatomical factors. So some people have naturally shallow grooves in their trochlear groove or weaker muscles in their quads, making the kneecap more likely to slip out of place. Some complications of the injury, if not treated properly, include chronic knee instability, which means that your knee may become more prone to future dislocations, leading to ongoing instability and difficulty with movement. Furthermore, the dislocation can cause the cartilage under the kneecap to become damaged, leading to pain and potential long-term issues like patellofemoral pain syndrome. Lastly, over time, the repeated stress and damage to the knee joint can lead to osteoarthritis, causing pain, stiffness, and reduced mobility. The estimated healing and recovery time varies from person to person and highly depends on the severity of the injury. So for non-surgical treatment, the healing time is about 6 to 12 weeks. Most people recover in this time frame with rest, physical therapy, and gradual return to activity. If the injury requires surgical treatment, then the average healing time will be about 3 to 6 months. If the surgery is needed due to severe damage or recurrent dislocations, recovery will take longer with an extended period of rehabilitation. Specific areas and muscle groups are targeted during physiotherapy exercises for this specific injury. This includes quadriceps strengthening, range of motion exercises, balance training, and hamstring stretches. The first exercise will be straight leg raises, which helps strengthen the quadricep muscles and stabilize the kneecap. The second will be heel slides, which improves knee flexibility. The third will be single leg stands, which helps restore knee stability and prevents future dislocations. And the last will be a seated hamstring stretch, which helps maintain flexibility in the muscles around the knee. Thanks for listening. Here are my references.